Good evening to everyone. My name is Marlon Hill. I am going to be the host this evening of a virtual town hall meeting about COVID-19 protocol and how we can celebrate and have a safe holiday season that starts in well over a week and a half. 2020, it has been a challenging year for all of us, all over the world, whether you're here in the United States, Canada, the UK, and certainly within the Caribbean region. We're here live on Jamaicans.com, and we are powering this virtual town hall meeting as to introducing some of the voices of the front lines of our community, in particular the Jamaican and Caribbean community that have been on the front lines of protecting us and keeping us safe and healthy during this COVID-19 period. Breaking news today, the first vaccine was inoculated. She was inoculated today in New York, in Queens. Her name is Sandra Lindsay. She's an ICU nurse, Jamaican descent, the first of the COVID-19 vaccine, which was distributed in the states of New York. Vaccine was also distributed in Tampa today, here in the state of Florida, and will be distributed as well at Jackson Memorial here in Miami, Florida, where I'm coming to you from, for the frontline workers who are going to be receiving the COVID-19 vaccine. This evening, we're going to be talking to you, giving you a refresher, if you did not already know, all the rules and protocol for you to how to properly wear your mask, how to properly remove your mask. We're going to be talking about how to celebrate and worship safely. We're going to be trying to demystify some of the information about the vaccines. Very, very important. We have representatives from the Jamaican Nurses Association and also the National Medical Association, all persons of Jamaican descent and Caribbean descent as well. We will also be welcoming the first woman mayor of Miami-Dade County, the largest county in Florida, Mayor Daniela Levine Cava as well. We will also be giving you some tips as how we can travel home safely to the Caribbean region. To welcome us to this virtual town hall meeting, we want to welcome Consul General Oliver Mayer. He's coming to us live here in Miami. He represents over 13 states, the southern states in the Electoral College that voted today. CG Mayer, welcome to the town hall meeting.
Thank you very much. Thank you. Happy to be here. Good evening to your listeners. And first of all, congrats to you, Marlon, for all the good work you've been doing especially over the last couple of months, keeping the community informed. And I believe that at this time, we have to ensure that we continue to observe all the protocols, take all the precautions. We have to live, but let's be careful while we do it. We still need to go about our daily living, but let's be careful. And I think the guidelines are all clear what we need to do. And I think once we adhere to it, we should be safe.
What are some of those procedures when you come to the consulate, CG, in terms of keeping the nationals and the visitors to the consulate? What are some of the things that did you put in place?
Okay. First of all, to come to the consulate now, you must make an appointment. So you have to go online at www.jamaicacgmiami.org. And so once you have your appointment, you come down. We have social distancing. There is a limited amount of people who can enter the room, and then you have to wait outside. So we watch social distancing clearly. We have a lady who is constantly cleaning, sanitizing the area. Of course, you must wear a mask. That's a must to come into the consulate, right? And we ensure at all times that the numbers are maintained, throughout, and social distancing. So, and the good thing, I want to call a lady's name, Anne-Marie, from very early perhaps in about March, Marlon.
Right.
Anne-Marie, in our office, I could not walk outside my office without my mask on. And I used to get annoyed at one point with her, right? That's Anne-Marie.
Giving you licks.
But
listen,
listen, man, she brought the discipline in our office. So from very early at the consulate, we have been disciplined. We all wear a mask. We keep our social distancing, and give God thanks. We have all been safe, and we have been taking the precautions from early. So the discipline has been there for us, and it's just a part of what we do. We don't take any chances. We always have on our mask, and we have been leading the charge from inside the consulate.
Has anyone from the consulate or their family members been impacted by COVID-19 at all, CJ?
We had a driver who was impacted, and he had an underlying condition, but everybody else has been fine. Give God thanks. And the driver, this was months ago, and he's fine now, up and about. But everybody has been fine, and just taking all the necessary precautions and serve while serving the community.
Well, CJ, we want to welcome you. Thank you for joining us here on the virtual town hall meeting. I'm sure that we can get more information about traveling home safely to Jamaica at the consulate's website.
Yes, and we coming to Jamaica, go to visitjamaica.com. Entering Jamaica, you need to have a travel authorization, right? So you must have once you go to visitjamaica.com, it's pretty straightforward. You want to ensure that you have at least 3 days notice.
Yeah.
Give yourself 3 days before you get the authorization. If you have a difficulty, you can reach out to us at the consulate. Print off a copy of your travel authorization when you go to the airport. You must take a COVID test, antigen test, and you no longer need to upload the result. You can walk with it to the airport.
Yeah.
And that will facilitate your travel to Jamaica. When you're going on visitjamaica.com, they have different categories. Pretty much.
We're going to be going into some of those details
Okay,
of
no
the Jamaica
problem.
Tourist Board later on in the town hall meeting.
Sure.
But certainly, if anyone has any questions, they can call you at the consulate as well. No?
Definitely. Yeah, we a number of the questions we get are related to the protocols going into Jamaica. So that's a standard. You can reach out to us at any time.
Consul General Oliver Mayer, thank you for joining us here. Hopefully you can continue to listen and answer any questions in the Facebook feed of Jamaicans.com and also on YouTube. Thanks for joining us.
If I may, Marlon, I know this is about health, but I must plug we're having a virtual concert on Sunday. I know you have a wide listenership, right? So it's on Sunday. We're raising funds to support the tablet initiative. We want one child, one device. Because of COVID, our children are at home, so we want to provide them with the devices that they need. And you can visit our Facebook page, Instagram pages to get all the relevant information of how you can donate. But it's going to be a concert on Sunday. It's a free concert. You can come and enjoy the concert for free, and you'll also have an opportunity to contribute. It will be live on PBC, live on the Consulate General page, and live on Jamaicans.com.
Awesome. Our family is a proud sponsor of one of those tablets already. So great initiative.
Excellent. And that's the Ministry of Education's initiative, and we're here supporting. We want to ensure that all our children are not left behind. We give them all the care, all the love that they need to compete. And we thank all the persons who have already contributed. And if you have not yet done so, you can log on to www.smileja.com, because that's in keeping with our theme, make the picnic them smile for Christmas.
Thank you, CG. Smileja.com. Thank you for joining us here on the virtual town hall meeting. Merry Christmas and happy holidays to the family as well.
One love to you and all the best. All the best to your listeners.
Thank you so much. So when the Jamaican men of Florida was trying to think of a way to turn up the sense of urgency about the pre-holiday season, we could not find any other better partner than calling on the Jamaican Nurses Association, an organization that has existed here in South Florida even before the organization was actually organized. They've been here for several decades. And with the first person receiving the vaccine in the United States being an ICU nurse of Jamaican descent, it was just meant to be that we're going to be talking with Lornette Patrick, president of the Jamaican Nurses Association. Lornette.
Hi, Marlon. Hi, Marlon.
Meeting.
Thank you so much for having me.
You know, I can't go to a hospital, no matter what kind of shape I'm in, and not running into a Jamaican nurse.
Definitely, we're all over. You name whichever country as well. we're there. So I'm really, really glad to be here this evening. I'm really glad to hear the CJ is also wearing his mask, and the lady who reinforced it's great. But what really got me going on, as we spoke a few weeks ago, is to see how the mask is being handled. You
Right.
know, because I've heard people say, you know, I have worn the mask and I still got COVID. You know, so the thing is, wearing the mask is one thing. So we have three things. One, how you put the mask on. Two, what do you do when you have the mask on?
Right.
And three, taking off the mask properly.
So
So I'll
walk us through the steps.
I will. So the first thing you do, I have here, because I have this is the level one mask. You can see it. I'm going to put it on, right? So what before you even touch the mask, you've got to clean your hands. You wash your hands, all right, or you use your Purell. That's a must. So you must wash your hands before, okay? So that's it. Wash your hands. And then you pick up the mask. So I'm going to use this is a level one mask. We have level one mask, which give you a fair amount of protection, and we have level two mask, which give moderate protection, and we have the cloth mask. Whichever mask you're using, the procedure remains the same. All right. So you pick up the mask and you have it by the exactly, and then you find at the top part of the mask, you'll find like a hardened area. You're going to pinch it. Just one quick thing though, because I've seen people wearing the mask inside out and upside down. I have seen it. So just remember, the mask, the outer part, the pleats go downwards, and the inner part, the pleats go upwards. So make sure you're wearing you're wearing it inside out.
Right.
And then the upper portion has this kind of very like a very stiff portion. That part is going to go over your nose. So you're going to pinch it because you want to make sure it fits properly over the nose. All right, so you pinch it and then put it over the nose and then over one ear and the other ear. And then you pinch it to make sure it stays. And then this goes under your chin. Now, once you have this mask on, you do not, and I cannot emphasize enough, you do not touch the front of the mask. You just don't. If it's loose, if you can probably tighten the the strings here. If it's a cloth one, you can tie it, or some of the cloth ones, like the one I have here, have adjustable. You can see adjustable on the thing, so you can adjust the how tightly it fits over your ear. Okay. I see people have like this and I cringe because what you're doing is contaminating your hands because this is contaminated. So let's take that the virus is crawling all over the front of this mask. Or let's think of it like that. So you don't. Yes.
So that is a level one mask or level two? What's the difference between level one, level two?
The level one mask gives that mild protection. The level two mask gives moderate protection.
So where do you know it's a level one or level two?
It tells you on the package because I went through Amazon. Tells you level one. They have level three, which you can hardly really this you can breathe through easily through this one, and the level two as well. You can breathe through easily. The level three is a little bit more difficult. The N95 I will not discuss because it's for medical personnel.
Right.
All right. So let's go back to the mask, and I go to the cloth one. So this fits properly over your, not below here, not down here, over your nose, and it stays there, right? And make sure it fits properly. Okay, so you don't touch it. If it feels loose, you could come like this and pull it up or pull it down, but do not touch the front of the mask.
Okay.
Now, when you're taking it off, you clean your hands again. You clean your hands again. Then you take it off. And then for these disposable ones, they go like this, don't touch it, and you drop it in a closed receptacle.
Okay. If you are going to wear a cloth mask.
Yes, I'm going to come to that one. Yeah.
Okay.
So the cloth one. So look, yes, after you take it off and you dispose of it, guess what? You have to clean your hands again. You have just touched the mask. All right. Okay. So you clean the mask again and you throw it away. Now the cloth mask, which I have here as well. This fits, this has an adjustable on the earpiece, it's
Right.
just work. The same thing goes. You wash your hands before, all right? Remember, these are disposable. These are one time only. One time you wear them, and that's it. It becomes sweaty. They become damp with perspiration. You throw them away. Okay?
In the trash bin, please.
In the trash bin, please. Not in the bathroom. I have gone and I've seen it on people's dining room table, and I'm about to die. I swear. With this side down, please. So this now goes again, same way over your face, right? Right. Again, you make sure it fits properly over your nose and your chin, and this stays on. You take it off, you're going to clean your hands again, right? You're going to take it off. Now the cloth mask can be worn, mind your glasses. The cloth mask can be worn, like, let's say you had it for a day, all right? Remember, you're going to dispose of this one once you're done, all right? If it's wet and sweaty. So this you can really get, so you fold it and put it downwards. Now, some people suggest you can have like let's say in the car, for example, you can get like a paper towel and put it on the car seat, wherever, and rest it on the car seat, facing like this. I've seen people say turn it inwards. Now, I prefer to have it downwards. So when you're ready to use it again, you can again pick it up and put it back on after doing the cleansing. At the end of the day, when you're done with this mask, right, again, take it off properly, like I showed you this one. You fold it, all right, and you can drop it in your laundry bin, in your washer, and wash it. What I do, and this art I do, is I take my groceries out first when I'm done for the day. Then I go back and pick up the mask like this, and I take it to my bathroom and I wash it. And then I air dry it. I don't push out of it. It can be hand washed or machine washed as well.
So the bottom line rule, Lynette, don't touch the front of the mask.
Don't touch the front of the mask.
Sanitize your hands before you put it on.
Yes.
When you're taking it off.
And after you take it off.
After you take it off.
That is crucial, because you see, what I do personally, I have the sanitizer in my car. So as I open the car door, it's right there. So before touching anything else, then the mask comes off. I've been doing this, looking for the CDC guidelines. I've been doing this, and then I take it off to my hands again. And as I get home, this goes in the trash. Or if I'm using the cloth mask, it's like this.
You, as a nurse, you were doing this before the pandemic at work anyway, right?
Yeah, we were. Yeah, exactly. Yeah, but not, we wash our hands like crazy after each patient. Before we enter the patient's room, we wash the hands. Before we touch the patient, and after we touch the patient, we wash the hands.
Right.
So you wash before and after as well.
Lynette Patrick, president of the Jamaican Nurses Association. They will be doing more events to help us during this pandemic. You can support their upcoming Christmas event. You want to tell us a little bit about that before you go?
On December 19th, we have a scholarship awards and celebration celebration. We have 4 scholarship recipients, 2 from Jamaica, and they will be on the program as well, and 2 from here. And we have Keith Lynn, who was honored yesterday. He'll be singing for us as well. And
little known Black history fact: Keith Lynn played for my wedding.
Is that right? Oh my gosh! So he'll be there, and the president from NAJ will be there as well. And then afterwards we have a presentation, and then we have music by the Empress to dance.
And the website for the Jamaican Nurses Association:
www.Jamaican Nurses Florida offl.org.
Jamaican Nurses of Florida. Thank you so much for joining us.
So visit us, please, on our site, and follow us on Instagram as well.
Thank you, Lynette. Thank you for giving us this great information.
Pleasure.
Season to keep us safe, to celebrate safe, to worship safe.
Yes.
And to make sure that we put on our mask using the loops only.
Yes, only. Don't touch the front.
There you go. Thank you, Lynette.
Pleasure.
As we await the vaccines here in Florida, to our frontline workers, especially our medical personnel. We have a number of personnel from our community that are serving on the front line. One of those ladies, she is one of the warriors on the front line. She is also leading the charge in developing the FIU College of Medicine, and longtime advocate in public health. I want to welcome to the virtual town hall meeting here before the holidays, Dr. Cheryl Holder.
Hi, good
Hey,
evening.
Cheryl, how are you?
Here, doing well, doing well.
How's the family? How's your health?
Hanging in there. I happen to be on quarantine again because of being close to somebody who is positive. But
Wow. So
day,
how many days are you into your quarantine?
day 11.
Day 11. So what do you do what are you doing during your quarantine? How do you pass the time?
I work. I just do all my stuff online. I just don't see patients for that week.
Okay.
It's okay.
You're on day 11.
Yeah.
So, Dr. Holder, you have been at the front of this pandemic when it started well over 10 months ago. How do you summarize this year? Can you capture it in a couple of words? How would you describe it?
It's what a year. It's just shocking. It's a time when we've seen all the gross inequities in our society expose itself. And we've seen something that's been happening for a while, which is that people who are living under difficult conditions and stress and having diabetes and blood pressure, not because it's genetics, but because of our, what we call the social determinants of health.
Right.
There's lack of access to good diet, the working two jobs, sitting too long, not having safe environments. So they end up with these chronic conditions. And then coronavirus comes around and accelerates their death. It's so sad that we could have done more to protect our communities.
So take us a little bit into the Holder home. What do you do to COVID-19 proof your home? Give us some of your insights.
I am like everybody else you've had on the show so far. I don't take any chances. You know, I've been around long enough, and I was here for HIV. And so as the people in HIV world, we go hashtag not our first pandemic. This means that I assume everybody's infected. So you stand 6 feet away from me, you wear your mask, you wash your hands, and we have no problem.
Okay.
So wherever I go, stand back. I just assume you're infected.
Step off, my youth.
Yeah, step away. I at work, at home, I don't allow anybody in. Luckily, I live alone, so it's easy. Deliveries, visitors, everyone, we do everything outside. It's not worth the stress. It's not. So
you take off your shoes, you shower immediately.
No, well, it depends. If I'm seeing patients, and the days I see patients, I'm an outpatient, so asymptomatic carriers are the biggest problem. So when I see a patient, I don't know if they're infected or not. So I'm going to assume you're infected. Because when you show up in the ER symptomatic, it's easy to say, don all the gear. When I see you in my clinic, you tell me, oh, it's allergies or it's something. I don't know. So I'm like, I wear my N95, I wear my shield, I stand back, I do a lot of hand washing, I wear scrubs and I wear a head scarf. So when I come home from work, the garage, everything changes off, drops it in the washing machine, and I go take a shower. And then I start my day.
So Dr. Holder, I saw the people traveling during Thanksgiving and I just held my breath. I said, geez, what are we doing? We know that we're not supposed to be coming in contact with each other. So the sorrel is on the stove. The fruit is in the blender. Everybody is getting ready to potentially come together. What is your advice for us of the top line advice that we need to make sure that we're doing going into this holiday season?
Show your love through Zoom. You cannot be happier seeing your family member alive. And if that means you see him through Zoom alive, it is so much better. If you can know that your bubble is good and you guys are all doing it, you don't leave the house, you're working together. And, you know, couples can do this, some folks can do it. The families can stay together and you stay together in your home. But it doesn't make sense to go visit other people because this particle, this virus is microscopic. On a pinhead, you have hundreds of thousands of the viral particle. So how are you going to know you didn't pick it up or they didn't pick it up? So I'm like, celebrate at home, celebrate with your group. The vaccine is around the corner. it's not worth the risk. It
So,
really is.
so celebrate only with the family that's in the house.
I say that's it. Now, if you're
Okay.
going to do anything, you can go outside, stand 6 feet away, and you celebrate that way.
If any family member comes over to the house to have dinner in the backyard, temperature checks, do we find out whether or not where they've been? What kind of questions should you be asking?
Asymptomatic spread is the biggest problem. People who have fevers and symptoms usually aren't going out. So it's the asymptomatic people that you got to be aware of. So you meet them outside. Don't share the utensils because you can contaminate the hand, the spoons and the knives. So everybody gets their own little kit. Everybody gets their plate. One person dishes out all the food, and you stay in your nice circle 6 feet away. And you can have a great conversation. Wear your shield. If you got to yell, then put a shield on with your mask. And you can connect as well, because the goal is that you want to see each other alive.
Yeah.
So you live with these limitations. I work with HIV. And when my patients were infected, I'm like, you have to wear this condom for the rest of your life. There's no cure. And yet,
so we are also celebrating in our places of worship. What's your advice for our pastors and for the members of the choir, or are we going to worship by Zoom as well?
Well, no, the guidelines are very clear. You can create a safe environment by distancing. You do the measurements, you alternate every pew, you keep the distance apart, you keep family clusters together. It can be done. Okay. The one area we say is do not have a choir. They now just showed a study that indoors, the person was there more than 20 feet away and only 5 minutes, and they know that person got infected, and that was the only place. So the choirs, you're putting all this pressure and sending that virus out many, many feet. So we don't.
So the alto singer that's in the choir, no.
What I tell folks who won't give in, because folks want to take risks, and we're a free world. So I say, if you're gonna sing in a choir, put the mask, put the face shield, and put the microphone up. So
and we probably shouldn't be passing the plate either, no?
No. There's no passing plates. There should be no Bibles. There should be nothing. You should have one entrance in, one exit. The person should be holding the doors. You should not have 50 million people touching your doors. So you have a person at the front door letting them in, a person at the back door letting them out.
One exit in and one exit out.
And the path should be one way. You shouldn't have people crisscrossing each other.
Okay.
So this saying hi, passing the piece, no passing the piece, no passing the plate, no getting up and sharing communion, none of that. It's only for another 6 months or so. We can do this.
Excellent.
It's hard, yes, but we can do it. I mean, we've done harder things before.
Absolutely. Dr. Holder, before you go, any other messages that you have for the community as we go into this season?
Hang in there. Show your love by seeing your family member alive. You don't have to see them and hug them to show your love. Just being alive is the most satisfying thing that you can ever imagine for your family. So do everything to keep them alive. Assume you're infected and stand back.
Dr. Holder, before you go, I know that we can get advice from the CDC website, which is at the bottom of our screen. Are there any other resources that you check personally that would be helpful to the public?
We pretty much use the CDC guidelines, National Medical Association, nmanet.org. We keep information there also that the Black physicians and information, things like vitamin D, which is not covered at all in the mainstream media. And we know people with low vitamin D levels do worse with coronavirus. So we want all Black people to be on vitamin D. That's one thing Black physicians are like, if you don't know your vitamin D level, take at least 1,000 units or 2,000 units a day and keep your level normal. Go get checked.
I have my vitamin D tablets. I just brewed some turmeric lemongrass tea today. What else do I need to do?
Perfect. Lots of vegetables. You want an antioxidant-rich diet because you got to lose the weight. Anything that's inflammatory, the virus hooks in and it creates a much more massive response against it. So that's why people who are overweight and obese do poorer. People with diabetes do poorer. So
after this pandemic, we should all be coming out looking nice and
fabulous. We should all be, because we should all be eating vegetables and turmeric and ginger and moringa, nice healthy teas, no extra sugar, no extra fat. We should be exercising to stay healthy so we can fight this corona.
Dr. Cheryl Holder, Florida International University College of Medicine and longtime public health advocate. Thank you for joining us here on the virtual town hall meeting. All the best to you. Not too much black cake, please.
No, of course you have to have a little bit, just a little.
Thank you so much, Dr. Holder.
Okay,
thank you so much. Coming up next, the first vaccines are here in the state of Florida. They're already in New York right now, and the shipments from the first vaccine that was approved here in the United States. Some people have a lot of questions, still quite a bit, a double percentage of the country is still skeptical about the vaccine. To help us to kind of understand what does the vaccine actually do to COVID-19, we want to welcome another one of our esteemed members of the National Medical Association and also neurosurgeon here in South Florida, Dr. Anthony Hall. Welcome to the virtual town hall meeting stage here at Jamaicans.com. Dr. Hall, how are you doing?
Great, Marlon. How are you doing?
So are you working from home as well?
No, sir. I'm out there every day.
So how is it like out there? What are you sensing based on where we are in this pandemic now? Are you concerned, or do you see some light at the end of the tunnel? What's your current emotion right now?
So I'm still quite concerned. I think we're still in the midst of the third surge, and it's not over. The vaccines are just starting to come out today. They are going to take months to have an effect. And the deaths are still at high numbers.
Yeah.
The illnesses and hospitalizations are at high numbers. Nationwide in our country, hospitals are really pushed to the limit, and including in South Florida. Some other countries worldwide have a better grip, but unfortunately, our country, through lack of leadership early on this year, does not have a good grip.
So, Dr. Hall, explain to us, if you can, in just medical terms, what does or what will the vaccine do as it relates to COVID-19, and why should people not be concerned if, in fact, the vaccines have been properly approved by FDA as soon as last week?
Okay, so this is a new approach to vaccines, okay? Typically, what we would do in the past, we would place a weakened or an inactivated germ into our bodies and then generate a response.
Okay.
These vaccines are what we call messenger RNA or mRNA vaccines. And
messenger RNA. RNA, okay.
Yeah. So what these vaccines are trying to do is teach our cells how to make a protein that then triggers an immune response. Now, this is not a new technology. It's been done in cancer immunology research. And there were a couple of attempts to make vaccines for the flu, for Zika, for cytomegalovirus in the past using this type of technology. So the scientists were all sitting and waiting, and the money came in to push this to a massive level.
Right.
We have 9 or 11 companies that have banded together. Many of them have made some partnerships to help them out, using a scientific technology that is now new, and the new scientists really want to push it. And this technology allows the development of vaccines much faster than the old technology. The old technology would take 2-3 years. This technology takes 3-4 months to make it, and then of course you have to enter into your trials to test it.
So are the vaccines different, Doc? The vaccines created by the different companies, are they the same science?
The same science. Basically, the Russian vaccine, the Chinese vaccine, which are out already. They've been out for over a month,
right?
As well as We have like 12 or 11 pharmaceutical companies in India, Canada, the UK, the European Union, the USA, Mexico, Brazil, all working on the same type of messenger RNA technology because it's the only technology that will work this fast.
So, Dr. Hall, when are you planning to get the vaccine for yourself?
That's a good question. Right now, I think I'm probably 7th down the list, so I'll get it next year summer or something like that because there's just not enough to go around. I have a couple of concerns. The technology is great. I think it's working well. And I've seen even editorials blasting out today from JAMA and the New England Journal of Medicine, emphasizing that the FDA is trying to look at the proper process. They acknowledge that phase 3 trials are not complete. They acknowledge that we don't have time for phase 3 trials right now, but they're ongoing. Hopefully, all the placebo patients, those are the ones who got the sugar injection and not the vaccine injection. Right. All those patients, or most of them, will stay in the group and in the study so that we can then compare months from now. Otherwise, the studies will be broken and lose some of their efficacy. So if that happens, if we keep analyzing as much data as possible that comes out with each group, we should have a good answer, except for the fact that we won't know necessarily what the long-term possible side effects will be. So
there's going to be a phased-in process for the vaccinations to take place. What's your advice to the public as to how they should educate themselves, preparing to build their confidence about and their awareness of the vaccination process? What would you say?
I would say it's tied in very closely to your risk of exposure. So that's why frontline workers and elderly residents in nursing homes are getting the first set of vaccines. Their risk to benefit ratio tips in favor of benefit by taking the vaccine without knowing all the long-term side effects. However, if someone is following those antioxidant and immune therapy protocols that you discussed with Dr. Holder and yourself, and I'm doing those myself, and you're avoiding and very strict with your mask and putting it on properly, like Lornetta said, and you're washing your hands and keeping your distance, you're much lower down the risk if you're not a vulnerable population. So you can wait longer. You can wait till the middle of next year when probably 9 vaccines will be out, including vaccines that don't have to be kept at minus 70 degrees Fahrenheit. And we will know a few more bits of information regarding long-term side effects. Not
Dr. Anthony
Hall, but
member of the National Medical Association. Are there any resources with the NMA, Dr. Hall, that you can direct us to that could be helpful?
Yes, NMA.net, as Dr. Holder mentioned, because the NMA does put out information, especially in regarding to the Black community and what we can try. We're putting out information to vulnerable communities like those with sickle cell disease as well. They probably should get the vaccine. They're at risk.
Dr. Anthony Hall, thank you for joining us here on the virtual town hall meeting. Miami-Dade County is going to receive its shipment of vaccines starting this week. Right now, newly minted elected mayor of Miami-Dade County, the Honorable Madame Mayor Daniela Levine Cava, slipping into the virtual town hall meeting to share some welcome thoughts. Madam Mayor, I've been waiting to say that.
Thank you, Marlon. It's wonderful to see you. I like the new look.
You know, it's a new day. Madam Mayor, I know that you and your husband were just recently diagnosed with COVID-19 and you're now out of quarantine. Freedom!
That's how it feels, I must say. It's wonderful to be
how are
back
you feeling?
out.
How are you feeling?
Yes, I feel fine. It was 2-week quarantine. And truthfully, my negative test came back after day 10. I was fine. But because I still had a cough and, just on the side of extra caution. But yes, now we're out. And thank you so much.
So, Madam Mayor, one of your first act was to appoint a chief medical officer, Dr. Peter Page at Jackson Memorial.
Yes.
What is his mandate?
Oh, he's been so helpful. What a great thing we've done. So Dr. Page is also the chief health officer at Jackson, and he is able to bring to us the expertise of the hospital on any question that arises. So we've been taxing him really daily with all kinds of issues and questions. How do we do this? How do we do that? And to help assure the public that we're speaking with one voice. So, for example, now we have all the city mayors on board with a single message. We have just launched a campaign called We Can, We Will, to showcase all of the activities that will keep us safe. And I must say, I need Dr. Holder and Dr. Hall to get on to our website. It's miamidade.gov/we can, we will. And please, you also, Marlon, and post an encouraging little short video message. Dr. Holder was talking about how to enjoy your holiday celebrations. Dr. Hall talking about the vaccine. It's so important that we all, only 6 more months or so, as was said, we can hold on and get it done. So Dr. Page has really helped us to stay on the same page with Dr. Page.
miamidade.gov/we can, we will. Do you have a briefing with Dr. Page every day?
Well, it's not officially scheduled, but I can assure you that I'm speaking to him on average more than once a day.
So what is the top line message? I know that you have been coordinating with the over 34 mayors of Miami-Dade County.
Yes.
And we are going through a transition in leadership across the country nationally as well. And your communications with the governor's office. What's your priority right now with regards to stemming the spread, besides the public awareness campaign?
Yeah, well, that's what the public awareness campaign is for, is to say, you know what, there is really no secret here. We need to mask. We need to stay distant. We need to wash our hands, disinfect. We need to stay just with our family unit wherever possible. If we're going into a closed space, we need to be there as little time as possible, because there are asymptomatic people and virus is in the air. We need to be outside. We need to enjoy this gorgeous weather. So these are the things that we know. And especially in a holiday season, when it's so hard, we really, really want to be together more so. And we're tired. We all have COVID fatigue. But don't forget, some people have died from this. Many people have become extremely sick from this. We have one of the highest rates in the world in the United States, and in South Florida, one of the highest rates in the country. So it's really on us. We can bring it down. And actually, let me just say, the most important part of this is to protect our healthcare workers so that they can be there to take care of us and not to overwhelm our healthcare system. That is the chief measurement, the number of available hospital beds and the number of available ICU beds. Because when we overwhelm our capacity, then they're not going to be able to take care of us.
Mayor Levine Cavo, one of the concerns I have is that people are going to see that the vaccine is being distributed and they're going to let our guards down that we are being cured.
Correct.
What would be your advice to the public?
Yeah. Well, that vaccine that somebody down the street is getting doesn't stop you from giving or getting the disease. And we're not going to have penetration at least till the summer. So, everybody is saying, Dr. Holder said 6 months, hold on, we can do this. It is fatiguing, but fatigue and impatience is nothing compared to illness and death. So we can do it. We can hold on for this last push.
Madam Mayor Daniela Levine Cava, you can get more information about the public awareness campaign at miamidade.gov/we can and we will stem the tide of this coronavirus.
And all the resources available are at miamidade.gov/coronavirus. So we have lots of information and we still have help available. We know people need help.
We thank you for your outreach. We can get the positivity rate well below 5%. Is that the goal?
That would be the goal. Absolutely. I mean, and we're hovering around 10%. So we're not in check. We need to really do our parts. Thank you. Thank you, Marlon.
Thank you for slipping into this COVID-19 pre-holidays. Happy Hanukkah to you and the family.
Thank you. Thank you so much. All the best.
All the best. Thank you so much. Mayor Daniela Levine Cava just recently elected on November the 3rd, 2020, first female mayor of Miami-Dade County, the largest of 67 counties in the state of Florida. She's on the campaign trail now to stem the tide of COVID-19 with the public awareness campaign, We Can, We Will. Please make sure that you go and visit miamidade.gov/We Can, We Will, wherever you are in the world. You should be following these rules, wearing your mask properly, removing it properly, constantly washing your hands 6 feet away. I say 10 feet. 10 feet. Stay away. Okay. If you are going to have any events, just worship, celebrate with the family only. If you're going to have any other family members over, like Dr. Holder said, please make sure that you're separating away as well. If you are going to travel, though, whether you're traveling, you are exposing yourself to risk. Some Caribbean countries are open, their borders are open. Some Caribbean countries, their borders are closed. To kind of give us some perspective on traveling safely and securely, whether you're going to travel in-state within the United States or you're going to travel overseas. Our good friends from the heartbeat of the world, Carlene Shakes from the Jamaica Tourist Board is here with us. Hello, Carlene.
Hey, Marlon, how are you?
You know, I miss me some Jamaica, you know.
I know.
I
We all do.
I wish I could, but I have a high-risk wife who has pre-existing conditions, so this is not the year to travel. But some people have to travel, Carlene, whether for business or for other family emergency matters, or they feel that they can take the risk. If you are going to travel to Jamaica, Carlene, I am all ears. What is the current protocol to travel to Jamaica? And we will also give some resources as to where people can see what the travel protocol is to their particular country.
Sure. Okay, as you know, we opened our borders June 15th. So before we did that, though, we had to ensure that our citizens are protected and also our valued visitors. So our government got together and everybody knocked heads together and we came up with some protocols. Now, when we started June 15, what we actually did was we were doing like every 15 days, we would actually look at the different protocols because as you know, there is no template, no textbook, nothing.
Right.
This is new to everybody. But as of November 17, we really looked at everything. We got, feedback from everybody, at least everybody that is traveling, not traveling, whatever, because, everybody always has something to contribute. So now the protocols that are in place will be from November 17 all the way to April 15. So that shows that we have learned a lot as to what works and what doesn't work. Okay. So right now, anybody that is traveling to Jamaica, you do need to get a travel authorization. In order to get your travel authorization, you need to go to visitjamaica.com/travel authorization.
Okay.
Perfect. So here we have a little presentation that will tell you a little bit more. It's very easy. It may seem at first that, it's a lot to go through, but as I said, we have to protect everybody that is on island and those that are coming on. So we're ensuring that passengers, they travel safely to Jamaica. So one of the first things you have to do, as I said, you go to visitjamaica.com/travel authorization, and that's where you actually apply for the approval to travel to Jamaica.
How far in advance to your trip?
Okay, you have to apply at least 5 days, no more than 5 days out. And in addition to that, you have to get a COVID test. Anybody that is traveling from the United States, you have to get a COVID test as long as you reside here in the US. Now, in order to get the COVID test, you have to do several steps. Oh, okay, let me follow the presentation. All passengers traveling to Jamaica will need to complete a travel authorization form, and it's no more than 5 days prior.
Okay.
The system will not allow you to apply earlier anyway. So the URL is there for you to actually apply. Now, if you're a passenger traveling from USA, as I said earlier, Brazil, Dominican Republic, Mexico, or Panama, you no longer need to upload the negative COVID test. We've made it a little bit easier because we were having a couple of challenges with uploading it. So what happened? You take it with you, but for the COVID test, you have to take it, but it cannot be older than 10 days. In other words, if you're traveling, say on the 24th, then you would actually count 9 days. So you count 9 from the 24th, you cannot take it before the 15th.
So Colleen, Christmas Eve is on the 24th. So if you want to travel to Jamaica right now, your test should already be done 10 days today.
Tomorrow latest.
Or
15th.
later.
Tomorrow latest, yes. So if you're planning to travel Christmas Eve, definitely hurry and get it tomorrow. Now, you'll notice that there are different types of tests. You have to do the PCR, or we recently added the antigen test. That one is a much shorter waiting period. And they have several locations that you can do the antigen test. So we were having a couple of complaints, I would say, from passengers because they're saying the tests are taking up to 14 days.
Jamaicans complaining, Colleen?
Not only Jamaicans, our valued visitors also. So, but you know, if you live in Jamaica, you know, of course, and you're visiting here, you're going back, you don't do the test. When you go down, you'll quarantine for 14 days.
Okay.
But Jamaicans living here, definitely you need to do the test.
I see. Okay.
Yes. So once you have your test, as I said, you don't have to upload it, but you have to take it with you when you're going down to Jamaica. Upon arrival, either whether it's Stansted or Norman Manley International Airport, of course, they always will do a brief assessment. You may have your test, but if we see that you're coughing or sneezing or anything like that, we'll do a further assessment. Just
what if I rush out to the house and forgot the piece of paper with the test on it, Colleen?
What if what?
What if I rush out to the house and forgot the paper on the table with the test result?
Well, make sure you don't. But outside of that, you would have got an email, correct?
Okay.
So the email will have it, but definitely it's best to print and take it with you.
You know how the runnings go sometimes, Colleen.
I know, but make sure you don't forget it. So that's what they said. Now, in addition to that, we have what's called a resilient corridor. So if you will notice, you see that red outlined area?
Right.
Okay, so from the South Coast, Negril, Montego Bay, Ocho Rios, Port Antonio, you can travel anywhere within the resilient corridor. You can enjoy all the activities that are actually approved to go.
Interesting. Okay.
Alrighty, so let's move on. Now, there are always frequently asked questions. They say, what information do I need for travel, for the travel authorization? You have to have your passport number, expiration date, and everything. Now, when you're applying for the travel authorization, make sure that the travel authorization, the name that you're placing on the travel authorization matches your passport. If it does not, then you're in trouble when you get to the airport because they're going to be checking the travel authorization and they're looking at your passport. So make sure it matches. The other thing that needs to match also is your COVID test. Because if there's any difference in the name, you will not be allowed to board. No, sorry. Okay. We have to be careful. Yeah. So the other one says, when can I apply? As we said earlier, for the travel authorization, you have to apply 5 days. 5 days out or less, but you can't do it beyond the 5 days.
So, Carlene, all of these frequently asked questions are located at visitjamaica.com. For the listeners and the viewers who may also be here as well, for the other Caribbean countries as well, you can go to CaribbeanHotelAndTourism.com. They have a listing of all the travel protocol for each country that you may be traveling to for the holiday season. But if you are traveling to Jamaica, this is, of course, Jamaicans.com. You can go to visitjamaica.com. Please follow the rules. There are no exceptions. They will turn you back to wherever you're coming from. Don't carry on and say you didn't know what the rules were and what the protocol was not. We want you to travel home to Jamaica safely and securely. Once you get there and you get to your family members, Carlene, any advice? Do they have to separate, quarantine, or no requirements?
Yes, definitely a 14-day quarantine. You mentioned family members. So on the travel authorization, it will ask you if you are not a resident of Jamaica, but they'll ask you, there's a list of accommodations that are approved. Outside of that, if you're staying at a private home, then you have to select that as your place of abode once you arrive in Jamaica. And then there are further regulations.
Colleen Shakes, one of our esteemed professionals at the Jamaica Tourist Board. You can get more information about their work, trying to keep us safe and secure during this holiday travel season. Go to visitjamaica.com. You can also learn more about your local travel protocol. Visit the websites for your local airports, Miami International, Fort Lauderdale International Airport, any airport. The websites have travel protocol for that particular state. Or if you're going to another country, make sure that you check with the consulate or the embassy and the information that the tourist board of that country is providing for travel protocol. Plan in advance. Make sure that you are wearing and removing your mask, courtesy of the Jamaican Nurses Association, properly. Only removing the loops. Do not touch the front of the mask, people. Wash your hands before you put on the mask. Wash your hands after you take off the mask. Wash your hands if you come close to the mask. Just keep washing your hands, sanitize your areas. If you are going to do any event out in public, make sure you're staying 6 to 10 feet away from everyone. If you are going to be doing any celebrating or worshiping, make sure that they are following the CDC guidelines at cdc.gov. One exit out, one exit in. Everybody moving in one direction, whether you're going in the pharmacy or you're at the supermarket or you're at church. It's the same process all over again that we need to make. We are following the guidelines. That's the only way that we're going to get the positivity route. We want to see you in 2021. This is the reason why the Jamaican Men of Florida, the Jamaican Nurses Association, and the National Medical Association and the Jamaica Tourist Board came together for this spontaneous virtual town hall meeting to give information about keeping us safe for the holidays, because we know that we are social people, but we're going to have to physically distance in order to keep each other safe so that we can get to 2021. Use the technology. If you have any questions, you saw at the bottom of the screen, the cdc.gov has great information. Want to also thank Madam Mayor Daniela Levine Cava. They have a public awareness campaign that's happening right now. Miami-Dade.gov. We can and we will. We have to take responsibility to take care of each other. We are creating a community of self-care. And I want to thank the Jamaican Men of Florida, Jamaican Nurses Association, and the National Medical Association, and all their local chapters, and all our healthcare workers that are working on the front lines to keep us healthy for the holiday season. Please have a safe and secure and blessed and spiritual and nourished. Make sure that you have your vitamin D and your turmeric tea and your zinc, and get your immune system up just in case you may come in contact with COVID-19. Until the next town hall meeting right here on Jamaicans.com. To the folks that are in the Facebook feed and YouTube, thank you for your comments. If you have any additional resources that you would like to share or tips that you'd like to share to keep each other safe, please be sure to post them in our feed. Thanks to everyone. Have a great and blessed night. Until the next time.